Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery Tips. So today I welcome you to the third lecture in the series Regional Surgery. I have already made 2 lectures. If you have not watched them, please do watch them. I will give the link of the playlist in the description as well as in the last of the video. Okay, so let us go directly to the lecture. So today we will be dealing with the surgical affections of nose, face, ear, head and horn. Okay. So before that, some formalities as usual. Do follow me in the Facebook and Instagram. In Facebook, little bit irregular, more irregular. Okay, so I post some surgeries, but in Instagram I am active in Instagram. I update different notes, PPTs as well as I update regarding the upcoming videos. Okay, these are the books which I am following. I have link to these 2 books. I will give in the description. Don't worry. Rest of the books you can purchase. Okay. After this class, you may not need to purchase. Okay. So first one, the nose. This is the anatomy of the nose. There are much more details. Okay. Just from the lecture point of view, I am giving some brief anatomy. Okay. So important one is a frontal sinus. Okay. Because there is a surgical condition of frontal sinus. Nasal septum, middle one the nasal septum, and there is different conchae. Conchae simply means bones. Okay. Ventral nasal conchae, dorsal nasal conchae, and there will be a middle. Okay. There are different meatus. Meatus means cavity. Okay. Dorsal meatus, middle meatus, and ventral meatus. Important one is the frontal sinus as well as the nasal cartilages. We will discuss nasal cartilage in detail. The first disease is the Brachycephalic Syndrome. It's in your course, Brachycephalic Syndrome. So, this syndrome is more particularly found in deep-chested animals or brachycephalic animals. So, this disease has 3 primary symptoms or syndromes. You can say that. First one is the stenotic nares. It means abnormally narrow openings. Okay, we'll see pictures. Don't worry. Next one is the elongated soft palate, which extends beyond the up to the level of the epiglottis. Okay, it goes up to the caudal to the tip of the epiglottis. Okay, more than 1 to 3 mm. Caudal to the tip of epiglottis. Everted laryngeal sacules. These 3 are more common. Apart from that, there are different other findings which may occur in association with the Brachycephalic syndrome. These 3 are primary or the classic components. On other concurrent finding, it may be hypoplastic trachea, ariepiglottic collapse. Other findings, it may be carunculate the cartilage collapse, tracheal collapse, tonsil eversion. All those things you can take a screenshot. All those things can be found, but more importantly, these 3 which are classic: elongated soft palate, laryngeal sacules, okay, and stenotic nares. These are the primary symptoms or syndrome. That is why it is syndrome, basically symptoms. Next, see the anatomy. So here there are 3 nasal cartilages. One is the dorsal, this blue color, sky blue. Ladies, you can tell which blue. So this sky blue is the dorsal nasal cartilage, on both sides. Okay. And here this slightly purple one, this purple one is the ventral lateral nasal cartilage. Next, this green one is the accessory one. There are 3 cartilage on each side, dorsal, ventral and the accessory cartilage. Now look at the nares. You can see this opening. Okay, this is the opening. It should be like this, but what happens when it is stenotic? This is closed. This is closed. You can see the difference in the dorsal cartilage. Okay, see how the formation of dorsal cartilage blocks the nares. Stenotic nares. You can see here this side. This is more prominent on this side. You can see. Okay, stenotic nares. Next one is the elongated soft palate. You can see here. This is the soft palate which goes up to the epiglottis. Okay, this is soft palate. This portion is the soft palate which goes up to the level of epiglottis. Laryngeal sacules, this one, these 2 sacules you can see, these sacules, these are everted laryngeal sacules. These are classic symptoms of a brachycephalic syndrome. Now how to correct them? First is the rhinoplasty. The surgery is the rhinoplasty. Stenotic nair resection. What you have to do? You have to take a triangular piece, V-shape piece from each side. From each side, you have to. Here it has been sutured after surgery. Here you can see a V-shaped structure should be removed along with the cartilage. Okay, this dorsal cartilage, this dorsal portion of cartilage should be removed. Not only the skin. Okay, these things also portion of the dorsal nasal cartilage to be removed. After removal, simply suture. When you will suture, okay, it will get contracted like this when you will suture, and this opening, the nasal opening will widen. Okay, stenotic nares. The surgery is known as rhinoplasty. Next, there are two surgeries for the soft palatal resection: staphylectomy, and a folded flap palatoplasty. These two are the techniques. For staphylectomy, simply you have to remove the extra portion of the soft palate. Okay, simply remove the extra portion and suture it. As simple as that. Resect. Here there is a technique. What happens? You can see here a portion, the ventral portion of the soft palate is removed. Now it will be rotated like this. Okay, flap. Now you have removed this portion. This portion is completely removed. Okay, now you have removed completely this portion. Now this portion will make, you will make a flap. Okay, like this you have to make flap, and it will be sutured here. Okay, you can see. Remove this portion completely and make this one flap. Simply it will like this. Okay, this half and this is another half. This half will come below this first half, or the, you can say this is cranial side, this is caudal side. Okay, so simply the caudal side flap or the portion will go below the cranial one. Okay, this is known as folded flap palatoplasty. Okay, next one is the everted laryngeal sacule. Simply you have to cut it out, but if you are going for laryngeal sacule surgery, be sure that it is causing the respiratory obstruction. Okay, otherwise it may not be needed. Okay, so this is simply you have to remove these sacules. Next disease is empyema of sinus. I told you the frontal sinus is very important. Empyema of sinus, it mostly you will find in case of equines. They have the frontal sinus, sorry, and as well as the maxillary sinuses. Okay, this is the ventral one. This is the ventral one, or you can say rostral one. This is rostral one, and this one is the caudal one. Rostral, maxillary sinus. There is a septum actually. This is the septum which divides the maxillary sinus to rostral and the caudal one. This is frontal sinus. This is frontal sinus. Empyema simply means accumulation of pus. Okay, so pus in sinus. Empyema of sinus. In case of dogs, you will find the frontal sinus. And so what do you have to do? Simply you have to look for some clinical signs. Okay, it may confused with the rhinitis. Okay, so it is kind of difficult to diagnose, but very thick compared to the rhinoplasty, very thick mucoid purulent material will come, discharge. It will be mucoid as well as purulent. You can see here mucoid and purulent discharge from the nares. Okay, or the nasal discharge will be mucoid and purulent. Very sticky mucoid. Okay, so what you have to do? You have to do trephining. Okay, you have to do trephining. This is the instrument which is known as a trephine. This is a trephine. So you have to simply inside the skin, piece of the skin you have to spread. Then by trephining, if it is maxillary sinus, then open the maxillary sinus, or if it is frontal sinus, then open the frontal. This is the frontal sinus. So in the frontal sinus you have to open and evacuate all this pus accumulated in the sinus. You can do rinsing with normal saline or any sterile water. Okay, so here you can see there are some anatomical landmarks. Here go for the frontal sinus. For maxillary sinus, you know that there is a septum, so you have to make two openings around the nasal septum. Okay, details are in the book. Okay, from your knowledge point of view, you should know that how much you can do. If you want some details, then please do refer the books. Okay. Otherwise, class will be very long. Next, the ear. Some anatomy, basic anatomy, you know that there is external ear, middle and the internal ear. So here external ear, the parts are pinna, auditory meatus and short canal. Okay, so this is pinna or canal can be divided in two. This is vertical canal, this is horizontal canal. Okay, now in the middle ear, the parts are tympanic membrane, auditory tube, that is the eustachian tube, and tympanic cavity. You can look here, this is the tympanic cavity, this portion is the tympanic cavity, this is the eustachian tube opening. Okay, here there will be three bones, malleus, incus, steps, malleus, incus, steps, from external to internal, malleus, incus and steps. Then the inner ear has bony labyrinth, has semicircular canals. You can see here, this is the semicircular canal, this is the extended view of this particular structure, and this is the labyrinth, bony labyrinth. Okay, here is the eustachian tube opening. Here one structure you should know, that tympanic bulla. This is basically the bone around the tympanic cavity is known as tympanic bulla. This is tympanic membrane which separates the external ear and the middle ear. This is tympanic cavity. These are basic structures. There are a few other basic structures from surgery point of view. Here you can see some structures. Important one is the tragus and antitragus. Here you can see a raised structure. This is known as tragus, and on the opposite side here you will find some folds, cartilaginous folds. These are antitragus. Okay, between the antitragus and tragus is the intertragic. Okay, intertragic incisor. This is the helix. Okay, medial border of helix. This is the lateral border of helix. Lateral incisor, you can see here there is a bifold. Okay, if you will see the dog's ear and a folds, that is the lateral incisor. And this is apex, antihelix. There are some eversions, antihelix, but the important one is the tragus, because most of the incisions will be around the tragus. Okay, most of the incision. Now in case of cat, there is a difference in the between the dog and cat. You will find a septum bullae. Okay, septum bullae inside the middle ears. This is septum bullae. Otherwise, all rest of the structure nearly similar. Okay. Next, the inflammation of the ear is known as otitis. It can be divided into externa, media and interna. Otitis externa, otitis media and otitis interna. Otitis externa, inflammation of the epithelium of the horizontal and vertical ear canal and surrounding structures. Media is basically the middle ear, and interna, as name suggests, the internal ear. It can be bacterial, it can be parasitic, it can be fungal, allergic or traumatic. Okay, basic principle is when there will be excessive moisture or increased humidity, there will be otitis. Okay. Next, the otitis, the medicinal management. Few basics you should know, though it is not a medicine lecture. So there are topical solutions like rinsing solutions, antibiotic solutions and its combinations, and systemic drugs we have to give, that is antibiotics, anti-inflammatory, antifungal, anti-inflammatory, depending which infection is there, how you are diagnosing to lab reports. After that you have to go for medicinal treatments. Okay, now coming to our surgical treatment. Surgical treatment has 5 different treatments for otitis. One is lateral ear canal resection, which is known as Jeff's procedure or Jeff's surgery. Vertical ear canal ablation, total ear canal ablation. Then bulla osteotomy, which can be based on where you are putting your incision, lateral bulla osteotomy and ventral bulla osteotomy. Okay, so lateral ear canal resections, in simpler words, what will happen? You have to resect the lateral ear canal, mostly the vertical ear canal. Here most you will do the resection of the vertical ear canal. Vertical ear canal ablation simply means you have to remove entire vertical ear canal. Okay, vertical ear canal. Total simply means vertical plus horizontal ear canal. All of them will be removed. Bulla osteotomy, these will be removed along with the, I told you, the tympanic bulla. The tympanic bulla will be incised. Okay, so that the middle ear is exposed. Let us see some surgical pictures. Okay, this is the lateral ear canal resection, that is the Jeffs procedure. First, you have to mark a site. Okay, this site should be marked based on that. That you have to see what is the length of this particular vertical ear canal. Okay, this length, this is up to the vertical, then horizontal starts. So this marked site should be, you can take a double distance or few distance from that point, junction point between the vertical and the horizontal. This is vertical, this is horizontal. So you have to mark a side beyond this point, mostly double or up to, you can say that 1 to 3 centimeter, depending on different dog breeds. Okay, from small dog breeds to large dog breeds, you have to guess that where you have to make your incision. Okay, experience also matters. Okay, but simply you can take a double distance. Okay, now next what you have to do, you have to remove the skin above. Okay, you have to remove the skin plaque. Then when you will remove the skin plaque, now you can see the vertical ear canal. Okay, so vertical ear canal, the lateral border, there will be medial border and lateral border. So lateral border of vertical ear canal, this is lateral border, you have to resect. You have to resect and you have to reflect it so that this opening of the horizontal, this is one of the horizontal ear canal, the opening of horizontal canal is visible. Now simply suture it, remove the excess portion up to this, this is the mark side. So whatever length you require, simply resect it out. You have to resect it out this portion. Simply you have to suture it. Simply you have to suture. You have to suture so that this horizontal ear canal opens to outside. This is lateral ear canal resection. That is the Jeffs procedure. Okay. Next one is the lateral, or you can say vertical ear canal ablation. So here you have to give incision just below the tragus. This is the tragus. Okay. So why you need this one? If there is some overgrowth or there is some tumor, then you have to do this one. So you have to give a T-shape incision. This is T-shape incision. This incision should go up to the level of a vertical ear canal meeting the horizontal ear canal. Okay. So you have to check for facial nerve while doing the dissection. Do check for facial nerve. So you have to open this one up, open this one, you can see clearly the vertical ear canal. Then you have to resect this one completely, remove this one. Okay, like this you have to remove. Okay, now the total ear canal, vertical ear canal has been separated from the surrounding structures. Then you have to see that this is the the horizontal ear canal. Simply the way you perform any stomy operation, okay, it should open to outside. Simply you have to do the suturing. These are basically the techniques. Okay, so a great surgeon can do wonders. Okay, so you have to suture. Okay, now the horizontal ear canal opens to the outside. This is the vertical ear canal ablation. Now the total ear canal ablation, simply the both vertical and horizontal will be removed. So here simply the incision, T-shape incision, it goes beyond the horizontal canal. Now same procedure, simply you have to go little bit deeper. Simply you have to go little bit deeper up to the level of this bone. Here will be bone to which there will be middle ear. Okay, after which the middle ear will start. So reach up to the bone and remove that portion. Okay, simply as simple as that. There you are removing the vertical one. Here the vertical and horizontal will remove. There is no need of any stomy operation. In the previous one, while you are doing the vertical ear canal ablation only, then you are opening the horizontal canal to outside. Here both are removed, so don't need anything, but may need a drainage pipe insertion because lot of dead space will be created, so you may need some drainage pipe insertion. Okay, this is total ear canal ablation. Now bulla osteotomy, simply after removal you can go further and resect a piece of bone of tympanic bulle so that tympanic cavity is open to outside. Okay, it can open. So this is lateral bulla osteotomy. Vertical bulla osteotomy, simply here the approach is, the approach is the lateral one. Here the vertical one. You have to make an incision from and cranial border of the atlas to the angle of mandible. This is the angle of mandible. So you have to make an incision. Simply the incision side depends on which type of bulla osteotomy you are doing. Okay, the lateral one and the vertical one. So here I from this article I have taken this picture so that you can see how the tympanic bulla appears. Okay, here you can see this is the tympanic bulla. This is the tympanic bulla. Okay, this is the entrance to the tympanic cavity. So when you will be doing the total ear canal ablation, you have to go to the level of this entrance. Okay, now when you will do bulla osteotomy, simply part of this tympanic bulla will be removed. See here. Okay, here you have to remove. This is the opening. This is the opening. Okay, understood? Okay, this picture actually clarifies your imaginations. Okay, how you have to perform. Next, oral hematoma, very common in almost in any veterinary dispensary. You will find the cases of oral hematoma. Okay, it may be due to any cause, mostly parasitic, or it can be any traumatic. Okay, blood tinged fluid accumulation on the convex surface. Ear has a concave surface and a convex surface. This is the concave, this is convex. Okay, concave and convex, mostly it will be on the convex side because blood vessels from the convex sides enters to the cartilage. Here will be the cartilage. Okay, it is the cartilage. So mostly the vessels will be ruptured in this side and will get accumulated. Okay, blood tinged fluid accumulation on the convex surface. Convex surface, scapha, then concave surface. I told you this will be the convex. The cartilage is known as scapha, then the convex surface. It may be due to head shaking, scratching, or ear mites. Okay, any region. There is some medicinal therapy, though not medicine class. Still you should know. Intralesional corticosteroids can be used like dexamethasone, methylprednisolone, triamcinolone. All these things can be used, and also you can use hematoma drainage, like you can use some teat canal pipe. Okay, Penrose drain, teat cannula, all those things can be used for drainage, but most of the time it will recur. Best one is go for the surgery. The surgery, here this surgery, simply you have to give S-shape incision, or some surgeons prefer a vertical incision. The principle is you have to suture it and there should be a gap between these two incision side lines. Okay, this side and this side should have some gap. Okay, now there are different techniques through which it is sutured. Some surgeons prefer through and through mitral sutures. Simply means see in lateral view through and through, but in book you will find it should not penetrate the convex side. This one is the convex side, this one is the concave side, and this is scapha or the cartilage. Okay, so it should not go beyond the convex, it should not come out of the convex, it should go to the convex side, and it should be put on the concave side. But most of the time you will find some surgeons, they have good outcome also. Some surgeons prefer for through and through horizontal mattress and not will be on the convex side. Okay, but in book you will find this type of method. Both of them work. Okay, so you don't need to worry. Now the bandaging technique is also important. You have to apply a tape to the, this is the convex side tape. Now you will apply to the concave. Okay, now you have applied, both the tape will be morphed, or you can say adhesive. Okay, you will join both these tapes and then you have to put over the head, like this. But before putting, place some gauze or any soft material, gauze along with cotton, soft material over the head, so that it should not be injured. Or this is hard surface, so it should not be directly placed on the hard surface. Okay, so you have to place it over a soft surface, though many times it can be placed. Okay, I have done few surgeries of oral hematoma initial time where I have kept the ear over the head. It will not cause much of the problem. Then you have to bandage it. Okay, then you have to bandage. During bandage, do try to the counter ear or the contralateral ear, so that the bandage will not slip easily. Okay, then you have to tell the owner to apply the Elizabethan pollen. Okay. Next, there is a oral hematoma pad. Oral hematoma pad, after surgery you can make. This blue film is the basically the X-ray film used, X-ray film, and this is the foam. Okay, you can make a pad. So the purpose of the making the pad is basically to avoid a trauma. Okay, because on the this is the concave side. This is the concave side. This is the convex side. So what will happen? So the knots are put on the concave side. So after a few days, when the bandage will be removed or the animal will remove the bandage, so this side will irritate the animal. So to avoid the irritation, this oral hematoma foam or oral hematoma pad is used. First you have to cut the required desired whatever the length you have to measure. Okay, how it is there, both the foam and the film should be cut. First apply the foam, then apply this film and suture it. Okay, here suture it, place 2-3 sutures. Now it's done. Okay, this is the suture on the final day. Okay, this is the oral hematoma pad. Next is the horn. Mostly it is important in case of large animals, large ruminants and small ruminants. Okay, this is the basic anatomy. This one is the cornual artery. This is the cornual artery. This is cornual artery. Okay, this is the ventral valves with the dorsal branch. This is the opening of the frontal sinus. This is the horn. Okay, this is the horn. In case of cattle, you will find the cornual nerve supplying to the horn. It is the branch of, you can remember it as clot. Cornual nerve is the branch of lacrimal nerve, is the branch of ophthalmic nerve, is the branch of trigeminal nerve. But in case of goats, interestingly, the two nerves supply to the horn. One is the clot, that is the cornual nerve or cornual branch of the lacrimal nerve. But here there is a branch of infratrochlear nerve, infratrochlear nerve. Cornual branch of infratrochlear nerve. It is a branch of nasociliary nerve, which is the branch of ophthalmic, which is the branch of trigeminal. Okay, so both the nerve has to be blocked. Simply you do the ring block. After cornual nerve block, do the ring block, it will solve the purpose. Okay, so this is basically the nerve blocks and anatomy of the horn. There is a procedure known as dehorning or disbudding. Dehorning mostly refers to the adult animals, disbudding in case of young animals. There are three basic methods of dehorning or disbudding. The first one is the chemical, then thermal, then cutting. Cutting is for the mature animal, but for the calves there is thermal and chemical. Chemical are basically used when there is bud, horn bud, that is the nerve disbudding will appear within the 3 to 7 days of birth. Okay, 3 to 7 days. This method can be used. Caustic paste of sodium, potassium and calcium hydroxide, it is applied to the horn bud, so that horn bud dies and it will not grow. Okay, so this is chemical method. There is a thermal where heat is applied. Okay, these are the instrument. This one is for the chemical one. This one is for the thermal one. Thermal. You can see here. This is the this is a thermal dehorner, and this one the cutting one. This is a keystone. Okay, and these are the wires which can be used for dehorning. This is for mature cattle or adult cattle. Okay. Next is there are some disease conditions associated with the horn. There is horn avulsion. In horn avulsion, most commonly the pulp cavity will not be open. Pulp cavity, whenever there will be opening of pulp cavity, there is significant opening which may lead to the infection. There is only surgery is the horn amputation. Okay, but if the outer covering is simply removed or avulsed and the pulp cavity is still intact and it has not opened, that is the frontal sinus is not open, then simply apply betadine. Best one is the tincture iodine. Now it is not available. If you can make purchase from different sites, online sites, it is available. Simply apply tincture iodine. It is a very good irritant Okay, then apply bandage, repeat for 3 to 4 days, and there will be horn formation. Very good result. Okay, now this is the horn fracture. Horn fracture, you see, whenever there will be horn fracture and the pulp cavity is not open, nothing you have to do, simply do the bandaging. Okay, nothing you can do. Okay, remember, when you will be doing bandaging of some horn, for some any pathology, then try to involve the other horn, otherwise the bandage will slip. It should be in figure of 8. Like suppose we are doing bandage this one, it should be like this. Okay, like this, figure of 8, so that the bandage will not slip. Okay, this is a technique. And remember, whenever you will be doing any horn bandaging or horn related things, be ready with local anesthetic to do the coronal nerve block. Okay, I see some surgeons doing the horn. Suppose, let us see this one case. The horn is removed, the hard portion is removed, and only the soft portion is there. Okay, the core is there. This is the core. So what will happen? These are very sensitive. So when you will touch or do bandaging, or simply you are using the tincture iodine, which is a great irritant, then animal will feel discomfort. You have a technique, coronal nerve block. Simply do a coronal nerve block, see the magic. Animal will, you may not need more assistance. Okay. The importance of anesthesia is always there. So this is a case of horn cancer. This is a case of horn cancer. In most of the horn cancers, horn amputation is the surgery of choice. Okay, or you can say treatment of choice. But sometimes what happens, even if you do the surgery, there will be recurrence. Okay, so this is basically the diseases, and the surgery for all this is the horn amputation. Horn amputation. Remember what happens in horn amputation? You have to make flaps. Okay, you can see here 2 flaps are being made. See here. Okay, these are 2 flaps. After making 2 flaps, simply remove this one by any, whether you can use hacks or wires or giggles or okay, whatever method you can do. Or nowadays there is some electronic cutters are also available from different companies. Those can also be used. Then simply suture. Only thing is you have to use anesthesia, that is coronal nerve block, ring block. If you have some sedation technique, confident enough, use that also. Okay, and remember, give incision as close as to the horn so that although skin can be preserved. Okay, depending, first you have to assess. See, when the horn is very straight, then some skin can be spared. Okay, but in case of buffaloes, in some animals like deer, okay, in some deer the horns will be bent. Those are little bit difficult cases. Okay, so when you will do more surgeries, you will know that one. So better is preserve the skin as much as you can do. Okay, you can preserve, do preserve. So this is all about the horn, that is the diseases of the nose, face, ear and horn. Okay, these are all the things, all the surgical affections of these. Next we will go for the, we will start the eye. Okay, there I think 4 to 5 classes will be required for the eye. So till then, tata bye bye, take care.